should be live there.
It is showing live. Woohoo!
All right. We can go ahead and get started. Thank you all again for joining us and for your patience through our technical issues. So we are here on another Webinar Wednesday, and it is our last one for February, and it is in recognition of Black History Month. And our theme today is clinical trials through the African American experience and making medicine work for all. So just a reminder, please mute your microphone when you're not speaking so that we can avoid crosstalk and outside noise. This is being streamed live to Facebook. And if you have any questions, this is going to be a really interactive session. So please, if you have any questions at any point, you can type them into the chat box. For those of you who are joining us on Facebook Live, you can type your question into the comments box, and we will be monitoring that throughout the webinar. This panel and this webinar is brought to you by the University of Chicago Comprehensive Cancer Center, Office of Community Engagement and Cancer Health Equity. We are the bridge between the University of Chicago cancer researchers and the communities that we serve. So we are happy to be here today. My name is Aaliyah Poulos, and I'm an education outreach specialist in this office. We are also joined today by Ms. Gina Curry, who is our Director for Community Outreach and Engagement. As well as Dr. Nita Lee, who is our Assistant Director for Community Outreach and Engagement and our Faculty Director for the office. So here's our agenda. We might be a little bit off time today, but we are going to be having a panel discussion. And before we get to the panel discussion, since the theme is clinical trials and clinical research, we're just going to give a quick overview of what that means and what that is, and then we will jump to our panel discussion. And I do want to introduce our panelists for today, and I'm going to give them an opportunity to introduce themselves in just a few minutes. But we have Ms. Janice Singh, Mr. Billy Foster, and Mr. Kenneth Martin, who will be joining us today to talk about their experience on clinical trials at the University of Chicago. And we thank you so much for our panelists today. They're taking time out of their day to talk to us and share their experiences, and we're really grateful to all of them. So thank you again for joining us today. Dr. Lee, I'm going to go ahead and throw this to you to talk a little bit, you know, as our clinical lead in our office, if you could just give us an overview of clinical trials.
Yeah, and I know a lot of people in the audience today are going to be exposed to this already and understand what that is, but just to put us all on the same page. So this is basically a clinical trials, any type of study that's testing a new way to prevent, find, or treat disease. Often we think of clinical trials when we think of, you know, in the cancer center, we often think about clinical trials related to a cancer treatment, but there can be different types of trials. And we're really making sure that when we use clinical trials, we're usually making sure that the medicines or any procedures that are developed are really safe and effective and really can help people at the public health level, but also help people at the individual level. Next slide. I think that, you know, just going over, sometimes trials can be prevention trials, which are like maybe either looking at a new medicine or some type of physical activity or some other type of thing to try to prevent certain types of cancers. We can be looking at screening trials for colorectal or breast or cervical or lung cancers or prostate. And then treatment trials like we talked about. And a lot of other trials are really looking at like using supportive care and focusing in on quality of life. So I think there's a large range of ways. Obviously with COVID-19, we've also learned about different things about trials related to testing and trials related to vaccines. And so those all sort of come across, you know, as the whole grouping of clinical trials. I think, you know, the benefits of clinical trials participation is really kind of, you know, the learning and adopting healthy behaviors, maybe for something for screening or prevention, access to new treatments, maybe earlier if you're participating in a clinical trial, new technology, and really just sort of advancing the science. And I think it's really important to think about clinical research being really, really for everyone and making sure that whatever trials and ongoing science that we're looking at really reflects our whole, like all of us in terms of like participation, because everybody's experience may be very different, and we don't want a trial or something to be put into place and then not necessarily reflect all of the patients that may be benefiting or all of the communities that may be benefiting when this intervention, whether it's a medicine or a intervention for screening, gets put into practice eventually. And so I really appreciate really being able to have a really good discussion, because one of the things that we know is that minority participation in clinical trials is lower than it should be. So it doesn't always reflect the general population. It doesn't always reflect the general population of a specific disease site or cancer site, and really kind of exploring what are things that could improve that, what are different people's experiences with it, as well as really getting really honest about what are the barriers and what do we have to do better in terms of really approaching this issue. So I'm really thankful for everybody participating today and for the ability to have our panelists. So thank you.
Okay.
So we're gonna jump.
Stop sharing.
Okay, you're gonna stop
Gina.
sharing. Okay. So yeah, we're going to jump right into it because we want to hear from our panelists. That's what this is all about today. And thank you so much for that overview, Dr. Lee. And again, we just so appreciate our panelists coming here today. Your experiences are so valuable. Leah and I and Dr. Lee, we're very community engaged and community focused. And when we're in the community, we hear so many times, I want to see somebody that looks like me that participated in a trial. I want to hear from someone, or they'll say, I never was going to participate in a trial, but my uncle, encouraged me to participate. So it's so valuable, your testimonies and sharing your experiences. And it really, it may seem small, but it really pushes forth our quest for health equity. It really, really does. And so thank you so much. So I'm going to start off with you, Ms. Singh, and I'll just call on each of you individually. First.
Sorry, Gina. Sorry, I'm so sorry to interrupt. So Kenneth, one of our panelists, I don't see him on here. He was supposed to call in, and I think I got a couple calls on my cell phone. I think that was probably him trying to get in touch to sign on. So we don't have him on yet, and I'm just going to turn off my camera and see if I could try to reach him. So just want to let you know.
All right.
So not on yet.
So right now it's just Ms. Singh and Mr. Foster. And if Ms. Renee wants to chime in, she can too. I know she's there with you. So, we're just gonna start off first, Ms. Singh, just tell us your background. Are you have a medical background, or what is your background, and what was the trial that you just tell us your story. What was the trial, and what was that thing that just made you make that decision to join the trial?
Well, a little over 2 years ago, I was diagnosed with a rare uterine cancer. I had surgery and it hadn't spread beyond the uterus, but Dr. Kim at the time told me that it could possibly come back in another part of my body. And unfortunately, 8 months later, it did come back in my lung. So at that time, I did 6 treatments of chemo, and it seemed like it had done the job. I was cancer-free. Unfortunately, 3 months later, it came back again. And that's when Dr. Kim consulted with her colleagues and felt that this trial would be a good fit for me.
Okay. And so, and what was your background? Like, did you have any kind of medical background, or just because of your relationship with Dr. Kim, that's, or just that they kept coming back? What was that motivating factor?
I'm not really sure about it coming back, but I work for the university. I actually work at the Booth School of Business in the dean's office as a secretary. And so I was doing my healthcare at the Hyde Park location. Okay. And so, of course, when I first got diagnosed, I was with Dr. Kim, and she's the one that diagnosed it. And that's who I've been dealing with, or I had been dealing with until the clinical trial, because now I'm not at Hyde Park, I'm at the Orland location under Dr. Fleming's care. Okay. Thank you so much for that. And I'm going to ask you the same question, Mr. Foster. I wanted to see, what is your background? Tell us your story. What clinical trial did you join? And, what was that motivating factor that made you make the decision that, yes, I'm going to join this trial? And you're on mute. Okay.
My story is a little bit lengthy. If we have 5 minutes for me to go through this.
We have time. This is all about you. Go right ahead.
Okay. Well, I was first diagnosed with kidney cancer in 1996. And at that time, kidney cancer was rather rare as far as treatments go, and there weren't a lot of treatments for it. And so I was recommended to have a nephrectomy or take the kidney out, which is what they did. And so I saw my oncologist periodically for the next few years. And after about 5 years, we decided that the cancer wasn't going to come back. I was good. But what happened in 2007 is I found that I had metastasis to my liver and lungs. And a little bit later, a couple of months later, we found I had lesions in my brain. And so at that point, my doctor, my local general practitioner, was one of my good friends. And I knew that he had just prior to this happening to me, some prostate trouble. And I was asking him where I should go. And I asked him where he went, for treatment. He said he went to the University of Chicago. So I said, I want to go where you went.
Right.
And that's how I wound up there. He called over and I was able to get an appointment almost immediately, unlike I'm able to do now, it seems. It was like, but I was blessed on that. And so what we did was there were only a couple of medications for kidney cancer metastasis and at that time. And so I was put on the top line one, sunitinib. I don't think I'm able to say the commercial name, so I won't say what it was. But anyway, I was on that for a few months, and aside from it just about killing me, it didn't stop the tumors from growing. And at that point, the doctor said, well, we have a clinical trial going. Would you like to participate in this clinical trial? And of course I accepted. The other choice, I'd be pushing up daisies, so to speak. But so I accepted the trial. And as it happens, after we were dickering around with the dosage and got the dosage straight and everything, then the clinical trial started. It kept my tumor. I have the kind of cancer that you can't get rid of, so I still have it. Okay. But the medicine was able to keep my tumor stable. And in some instances, it reduced the size of some of the tumors. But I had the lesions in my brain were gamma knifed and they have not come back. But I still have the tumors in my lungs and liver now. And the clinical trial went on until from 2007 to 2013. I was in that clinical trial. And they stopped the trial because it wasn't working for enough people, but it did work for me. So at that time, it went off for something, I don't know. But at any rate, am I still on?
Yes, yeah, we can hear you, yes. Mm-hmm.
So at any rate, and this is why I'm a research advocate, is during that period of time, those 6 years, researchers were able to come up with a few other medications, and I was put on one of them, and I'm on it to this day. And so that medication is also keeping my tumor stable. And that's kind of the short explanation of where I am.
So, Mr. Foster, I'm going to, Kenneth Martin is on, but you mentioned two things that I want us to loop back around. I'm going to have Kenneth tell his introduction, but two things I want to loop back around. So I'll loop back around to this. One, you talked.
Could I just say one thing before?
Sure, go ahead. Mm-hmm.
I forgot to tell what I'm by profession a music teacher and a jazz piano player. And I have a radio show. And I once did a commercial for the University of Chicago.
Oh, wow.
A TV commercial.
I didn't know that. We're going to have to dig that up, Aaliyah.
I just thinking that.
That's great to know. But two things I wanted to loop back around to a little bit later on the panel is that you said that the, that the drug that you had just was not working at all. And then you just talked about how you had this relationship with a person who referred you. So I want to talk about that relation, just how that encourages a person, and also kind of walk through, and I'll ask everybody on the panel your experience with the actual trial, because you said something else interesting, that they actually stopped the trial. It was working for you, but it wasn't working for enough people, so they stopped it. So we're going to talk about that a little later, but we'll put a pin in that for now. And then maybe Dr. Lee can even chime in once we hear from everybody about that idea of, if a trial is not helping enough people, they'll stop it, and where that leaves a patient that it is actually working for. And I don't, we don't have to have a deep dive into that, but I just thought that was very interesting. Thank you so much, Mr. Foster. We're going to now call on Kenneth Martin. Kenneth? You might have to unmute your phone. Yeah. Mm-hmm. Kenneth?
Hello, yes, this is Kenneth Martin.
Thank you so much for coming on. You were highly, highly recommended by Dr. Brisa and Dr. Roberson, so we appreciate you taking out time today. So we were just going, we have two other panelists, and they just introduced themselves, gave a little bit about their background. They told us about what trial they participated in. So tell us what trial you participated in, and just kind of, tell us your story. What made you participate in the clinical trial that you participated in?
Okay, well, I participated in the COVID-19 study.
Okay.
And what made me want to try to, see, because I've had a couple quite a few deaths around close loved ones. A lot of people I know have succumbed to it so fast, and some people wasn't taking this thing serious, but once it hit home, I felt like, I wanted to see what I could do and see if we could try to come up with some type of solution to get it. To try to stop this pandemic. So I just wanted to try to be a part of the solution. Not being a guinea pig, but maybe it'll help me also.
And you make a good point, and I'm glad to hear that you participated on the COVID-19 trial, because that's like all of the news now. That's like, everybody is talking about that. And like you said, so many people have succumbed, particularly, communities of color, and you lost a lot of friends, and so it's very personal for you, and that is sometimes a motivating factor for people to get into clinical trials. It's just, it's such a personal, like you said, it hit close to home, and you wanted to just be part of the solution. So I appreciate those comments. I'll call on you again just to talk about your experience, what happened, when you joined the COVID-19 trial, what happened. But I'm going to throw it back over to Ms. Janice Singh, and for that actual question. So we're just kind of going to do a round robin around, what was your experience? And I'll start with Ms. Singh and then Mr. Foster, and then we'll come back to you, Kenneth, okay?
Okay.
I started my treatment last October, and I go every 2 weeks. The phlebotomist comes to my house to draw blood the day before. So I see the doctor before I do the infusion, and so she examines me and lets me know what my test results were, and then I address any concerns that I may have with her. And the infusion, it only takes about an hour, but I'm usually there for 2 hours total. And I also take an oral medication twice a day. And I have to check my blood pressure every morning before I take the medication, because they have to make sure my diastolic pressure doesn't go above 100. So they keep a very close watch on me during this trial.
So you said two things that I'd like to follow up about. You said that the phlebotomist comes to your house the day before. So now, and maybe, I don't know if you don't know this, but is that because of COVID-19, or is that just do you know if that's because of COVID-19 that they're coming to your house, or is that like a normal procedure? And two, you say you take your blood pressure. Was that given to you as part of the trial, like a blood pressure monitoring kit that like uploads to maybe your doctor, or how does that work?
Well, regarding the phlebotomist, I'm not really sure if it's due to COVID. I was just told when I initially started, before I started, the nurse told me that the phlebotomist would come to my house to draw blood. Because you're right, previously. There. Okay, yeah, because previously I would have to go to the clinic the day before.
Right.
Yeah, so
that's one good thing that has happened.
It's a beautiful thing. It is a beautiful thing. And regarding my blood pressure, yes, they gave me a blood pressure monitor, and I have a log. I have to log in what my blood pressure is each day, and I have to log in how many pills I take, how much oral medication, and the medication I have to take at the same time. In the morning and at night, I have to do it at the same time. And so that's something that I had to get used to, but it's okay. I'm kind of like in a rhythm now that I know what I'm doing.
Okay, great. So I'm gonna ask you the same question, Mr. Foster. Kind of just walk us through, like, what did that trial look like? How often did you have to go? What did you have to do? We want to kind of demystify, like, what is a trial? I talked to a lady and she felt like she thought she was going into a torture chamber. She didn't know what was going on. So, like, tell us kind of like what it is, because like what Ms. Singh said, that doesn't seem like a big deal. Somebody comes to your house, take your blood. It's not scary as some people think. So share your experience.
Well, after you get, it's certainly scary in the beginning, but after you get what you have to do, then you aren't as frightened as you were from the beginning. But when I first started this, I had to have a CT scan once a month to keep check on the size of the tumors, and of course, the medication is an oral med that I still take every night, and the cancer med drives your blood pressure up. So I'm also on blood pressure medications because of the cancer med, and also I have a thyroid condition that the med causes, so I'm taking thyroid medication also. And every now and then there are other problems that crop up, but we have a funeral home here in the city where I live in Gary called Guy and Allen, and somebody asked me about how do you deal with those side effects, and I tell them they're better than the side effects they have over at Guy and Allen.
Right.
Yeah, that's true.
Exactly. That's a good one.
Well, that's kind of the way I look at it. It's not that bad, and my life is fairly normal, and I wouldn't be here without the clinical trial.
So your quality of life is not greatly impacted. It's actually pretty good, is from what I'm hearing.
Yeah, well, the way I look at it is, I have the cancer, so you just kind of have to make room for the things that go along with it, and not complain, and go ahead and do the things that you can do.
Yeah, I see a lot of people nodding. You're absolutely correct. And just, I don't have a clinical background, so I don't want to assume people do. When you say a CT scan, is that big machine that you lay down in? What is the CT scan?
It's one of the donuts.
Oh, okay. They put you through the donut. Okay. Okay. All right. Because I don't have a clinical background, so I know sometimes when sometimes people don't know, because sometimes I don't know. So.
And usually trials will have, I'll just say that usually trials will have that built in as part of the safety to make sure that like a new medicine that's being tried is working. So we have a way to check, like, did it work? Did it shrink things? Did it keep things stable? So that's like kind of built into the rules sort of the trial,
Yeah.
Obviously, everybody can change their mind about whether they participate or keep participating, but those are kind of like just that, and the labs and side effects really are kind of like all the ways we want to make sure anybody doing the trial feels safe and knows what the plan is.
Well, one of the other things that we did too was, for some reason, once a month they were checking my heart. I don't really know why that was, but that was part of the clinical trial process.
Okay. So Kenneth, I'm going to ask you the same question. So you did the COVID-19 clinical trial. So tell us how that was. You know, did you go in? Did somebody come to you? Tell us what happened. Walk us through it.
Okay, well, I had to go into the hospital and, you know, they give us a blood test. You know, first they give us a big old lengthy questionnaire, you know, because
Right.
basically it's voluntary, you know, you're not obligated. So it seemed interested. So, you know, I signed up and, you know, we have to go, you know, have a blood test and, you know, vitals and all this and that. And then basically we on a daily regimen, you know, we do symptom checks over the, you know, the phone, you know.
Oh, okay.
You know, and then we have a visit once every 2 weeks, you know. We have a schedule, you know. We get our pulse checked and, you know, we have temperature logs, you know. So.
And you have to do that every day.
Yeah, we have to do the symptom check every day, you know, and log our temperature, you know, and we have to report it weekly. Then we do the daily visit. I mean, we do a visit every 2 weeks, and you have it by choice. They could come to your house, or you could go to the doctor, you know, whichever you choose. So they make it as convenient as possible for you.
And you've gotten an injection, or what is that?
Yes, we got the injection. We got the, you know, it's a vaccine. Mm-hmm. So before they start coming out with them, I felt like, you know, well, it's a study, so I might be I'm one of the first to get the shot.
So you know for sure you got the shot, or you don't know if you got the shot or not?
Yes, no, I know. Yeah, we got the shot.
Oh, you actually did get the shot. Okay,
yes.
Great. Okay.
Yes. But
because I didn't know if it was like
a
control group or what. So you actually got the shot. Okay, got it.
Yes. And I haven't had any symptoms or anything like that. So everything's been like kind of. I haven't had any reactions or anything, you know, like swollen or anything, you know. And my symptoms been fine. So.
And we have a question.
I want to go ahead to report.
Okay. And we have a question from the audience. So since they're asking specifically about COVID-19, I'll just ask you now. How did you hear about it? The audience member is asking, how did you hear about the trial?
Okay, well, I work at a nursing home and they had it on a bulletin. Okay. I got it off a bulletin board.
Okay.
Yeah, you know.
So you found out about it through somebody posted it at your job. Okay. So I'm looking at the time. I wanted to ask, I'm going to ask a combination questions. And I'm going to start with you, Ms. Singh. Would you recommend that others join a clinical trial? And also, are there any barriers, you know, to joining the clinic? Like, did you have any barriers to join the clinical trial? We had a survey, they had a survey, and they said like one of the biggest barriers was like the cost of parking at the university. And you're saying that you know, somebody's coming to your house, so you don't have that barrier. But right. Are there any other barriers that you could foresee or that you could see? Like, would you, you know, encourage someone to join a clinical trial? And if so, are there any barriers that maybe you would like give them a heads up about, or maybe you may see that you could tell us, and then maybe we can make sure that those barriers no longer exist? Ms. Singh.
Well, I definitely would encourage others to think about a clinical trial. It's very important because it helps other people. I know some may think that they're being a guinea pig, but it really does help other people. And that's what made me decide to go ahead and do it, because my cancer is rare. It's not a lot known about it. And when I had this opportunity, it wasn't hard for me to make. I was nervous about it, of course, but it wasn't hard for me to make that decision, because I felt that had I gone with just a traditional treatment and then it only worked temporarily, I would be back at square one, and I would have gone through all of this for nothing and then consider the clinical. So that's why I decided to do the clinical. It was extremely easy, honestly. Like I said, Dr. Kim had the discussion. I even asked her, well, what do you think? And she immediately said, I think you should do the clinical trial. And once I met with Dr. Fleming, oh my goodness, they made everything so easy. It was a no-brainer for me. And I have to say, I'm really fortunate, because I go every 2 weeks, and there is no fee at the Orland location. Parking is free at Orland. Okay. So that is a big plus. So yeah, because going every 2 weeks, that could go up, that could get costly. So I don't really have to have that worry.
That's wonderful. What advice would you give anyone about joining the clinical trial? Like, if you give them one piece of advice, what would that be?
That would just be to have an open mind. Go in with an open mind, listen to everything. Because I think you had said before, Aaliyah had said before, you're not forced to stay in this program. You may decide to try it and then think, well, no, this is not for me. But just give it an open mind and see what happens. Because it is working for me, actually. And I'm really grateful for having been offered this opportunity, because it's a scary thing. And this is my third go round. So, and I'm just being fortunate in that they're catching it early enough that it can be treated. At least that's my thought process behind it. So yeah, so just have an open mind about it.
Absolutely. And Mr. Foster, I'm going to throw the same questions to you. Would you recommend others join the clinical trial? I mean, you said that you were diagnosed with kidney cancer in 1996. And you said you still have a good quality of life. Would you encourage others to join clinical trials? Are there any barriers maybe that, we should know about, to maybe help it go easier for people and to join clinical trials? And if it was one piece of advice, what would you give to someone that's thinking about joining the clinical trial?
Well, before I say anything about that, I would just like to mention this, if anybody, maybe it might be helpful to somebody, but the parking thing, you can go to the parking, there's a parking office in the new parking lot and the old parking lot, and you can get these blue tickets that cost $6 each. I usually get 5 at a time, and you can stay in the lot all day for $6.
Oh, wow. That's a great benefit. And is that for anybody or just people in clinical trials?
No, that's for anybody.
Oh, okay. So that's good to know. And it's all kinds of people that we see. So even sometimes $6, like I had a person that they were in a blood cancer clinical trial, and they said they had to go every day. So even $6 every day, that would be a lot, So, but that's a good resource to know. So thank you very much for bringing that up. Thank you so much for that.
As far as the clinical trial goes, the clinical trial that I was in, the company that was doing the trial paid for everything.
Oh, good.
So I didn't have to pay for medicine or any of the exams or anything like that. And what brought me to the clinical trial was that the best medication that they had at the time didn't work. So one of the doctors told me, if we don't find something to corral this, in a couple of years, you'll be dead. So that was kind of incentive, let's say.
Right. That was a big incentive.
There wasn't much of a choice to be made in that.
Absolutely. And it worked out. So you're here to still tell the story. So
my next thing was where are the papers?
Right. Where do I sign up?
But the clinical trial was successful, and the other part about it was it gave that length of time gave them a chance to research and come up with this other thing that I'm on now.
Okay. So now they've developed something based on your participation. Okay.
Based on the med that I was using in the clinical trial.
If you had one piece of advice, what would you give to someone considering a clinical trial?
I would tell them to, like Ms. Singh said, give it a shot, at least give it a try, and you might find that it'll, do you better than the med that you're on.
Mm-hmm.
I would advise them to try it anyway.
Okay.
And aside from that, if you have like a helping kind of heart or a give back kind of heart, it gives you a chance to do that too.
Yeah.
Yes, absolutely. Absolutely. Helps you to be able to contribute to science and future generations and hopefully eradicate. Kenneth, I'm going to throw the same question to you. Would you recommend joining the clinical trial to other people? If you had one word of advice, what would it be?
Well, I would highly recommend it. Just be optimistic, I mean, whatever ailment that you may be going through, they're just doing nothing but trying to make it, find something to make it better, make you feel better. So,
absolutely.
So I highly recommend it.
And did you have any barriers? Everything was paid for. Did you have anything?
Did I want to say about the parking? When you go there, I mean, they're so courteous and professional to you. And if you drive, they pay for your parking. They give you validation. They give you parking validation. And if you took public transportation, they would give you they would reimburse you for that. So they make it very convenient for you.
Well, that's wonderful. That's good to know. That's good to know. So I mean, I'm looking at the time. It's 1:15, and I do want to open it up for questions. Dr. Leah, am I missing anything? Can we open it up to other questions?
I agree. Okay. I would just like to say that I think what this session has showed me is that just the experiences, I know they've been really hard. So I feel I really appreciate everybody sharing. I would say really, if you have a family member or you yourself have a health condition that a trial could be an option, just asking your doctor like, hey, is there a trial for me? Because sometimes it's not actually that patients are hesitant. It's just that doctors haven't offered it to everybody, right? And so I think equally being like really aware of saying like, hey, I have this, I don't know what cancer, breast cancer, or I have this, like, what are my choices for clinical trials? And that asking that question, like, can be really an important step to really advocating for like your family member or yourself, because while we try to make sure from a physician perspective to make sure that we're actually offering these trials equally, I think that there are biases there and like kind of assumptions of like, oh, maybe somebody wouldn't want to do a trial or maybe they'd be nervous about it. So like kind of flipping the script and just being really open about that, I would definitely advise as advice to people who are in, dealing with either cancers or other options.
I would like
to comment on that.
Yes.
Aaliyah, you made a really good point because I did kind of feel that way because when I did the first treatment, I did 6 treatments and these were 4-hour treatments. I lost my hair. I mean, I was sick all the time. And then 3 months later, I'm offered this clinical trial. So I did wonder like, well, why did they offer this to me at first? So that is a good point because I didn't think to say, is there a clinical trial?
Sometimes certain trials are open for patients in different stages. Like some trials are only for patients who've had a recurrence after a certain number of chemo. So there's a lot of like funny things. I totally hear what you're saying though, Ms. Singh, that like it can be confusing.
Mr. Foster?
Yeah, I just wanted to say that you guys near Chicago there are very fortunate to be near a facility, actually more than one facility in your area that offers clinical trials, because if you're out in most places and you're dealing with your local community hospital, they don't know about these trials and they don't offer them, so a lot of patients outside of your area don't even know that clinical trials exist.
You make a very, very good point. And that's one of the things that we're trying to do in our office is to just raise awareness. We're not give education. We're not saying you must do a clinical trial, but at least be able to have, informed decision making, I guess is what they call it, where you know the options, and then it's up to you. We can give you the education, we can give you the options, and then it's up to you to choose. And we're not pushing you, you have to do it. But exactly what you're saying, Mr. Foster, some people don't even know they exist. So right. I thank you for that comment. Are there any questions from the audience? I
just wanted to chime in that I did just share in the Zoom chat. UChicago has a webpage, for this institution specifically, about finding clinical trials at the University of Chicago, and they have I just shared the link to that. And I'm glad that you brought that up. When they survey people about clinical trials, one of the number one reasons why people choose to do a clinical trial is that their doctor recommended it, or one of the number one reasons why they don't participate is that it wasn't recommended to them by their doctor. So having that, Gina, like you said, that informed decision making with your doctor, that if they don't recommend it, maybe you could ask about it, is really important. And same thing goes with the barriers, right? If you want to participate in a clinical trial, but there is a barrier like parking or something else, bringing those concerns to your doctor, whoever you're speaking with, sometimes can bring about changes that, okay, we didn't realize that was a barrier. So now we know that we need to make changes moving forward. So just making sure that you're, communicating those needs with your care team. Do we have any questions here? I'm gonna monitor the chat here to see if there are any questions. Oh, and Dr. Lee just shared the national, see, everyone is sharing links. This is great. So Ms. Ashley Lopez said here's another website for trials in the Chicagoland area, and that link is in the chat as well. And Dr. Lee just recommended a national clinical trials link to find clinical trials, anywhere outside of Chicago or outside of the Chicago area. So thank you so much for sharing those links.
On occasion, Renee and I go to health disparities meetings that the AACR has, American Association for Cancer Research. And at one of the first meetings, I was shocked to find that Latin Americans and African Americans are only 5% in clinical trials.
Aaliyah, maybe you could share that statistics for us. I was going to say, you set us up, Mr. Foster.
That is perfect. So I'm going to go ahead and share my screen for
perfect segue.
Just talking about.
You didn't even know we were going to put this on there, but that.
Yeah, we were like, we'll see how much time we have. So here, okay. Yeah, so this is a look. Dr. Lee, do you want to talk about this?
Yeah, I mean, I think this is just reemphasizes why diversity is so important in that, when we're looking at like older, looking at 2003 to 2016, in terms of like how many, like the different percentages you can see here of who were participating in clinical trials. So fewer than 1 in 20 adults with cancer enroll in clinical trials altogether, and then minorities are even less likely to participate. And I think that this is just a really striking statistic. And I think that we do know that there are some cancers that may affect different groups differently. And if we don't actually have a trial that reflects that in kind of just the age and the ethnicity or the other medical issues that somebody may have, then maybe that treatment that gets developed, we don't find out what works for people, right? So that I think is really, really important to kind of emphasize for sure. And
one thing I want to point out, Dr. Lee, not to cut you off, and I often I say it jokingly, but I'm very serious about it. Like when we're talking to community people, and it's even been said a few times on this webinar, like, I don't want to be a guinea pig, and we hear that so much. But guess what? If you're not part of the clinical trial, you're a guinea pig anyway, because when they come out with these medicines and these treatments, if you weren't represented, you're a guinea pig anyway, and you're still taking the medicine, you're still taking the treatments, so you're still a guinea pig. So it's like, be on the front end so they can make sure that you've been studied and that kind of thing. And then, it could be more generalizable, because that's the whole point. You want these medications and these treatments to be generalizable to the entire population. I just wanted to interject that part. I didn't mean to cut you off.
Yeah, no, I think that's a really important point, because I do agree that, like, I think we just really want that to reflect the reality. I think somebody had a question in there about why aren't clinical trials as given as one of the first options for treatment. Actually, there are a lot of clinical trials that are for first options. So it depends on like which trial is open. But like, for example, when I think of like my case of like GYN cancers that I take care of, we have some that are open for certain diseases that are for the first line, some if somebody's had prior chemotherapy, or some if somebody's had like more than 2 chemotherapies. So there's a lot of different rules on how they study people, but there are for sure trials, and some trials have chemo in them and some don't.
And I wanted oh, sorry, Gina.
I saw another question. What more do you think can be done to address vaccine trial hesitancy?
Do you want me to go to this next slide, Gina, that talks a little bit about that, the vaccine
slide
hesitancy, or the vaccine hesitancy?
And I would just say first, just first and foremost, platforms like this. We're talking to a panel of African-American people. It could be Latin, Latinx, Native American, whatever. A lot of times testimonials go a long way, because people don't want to see, the everyday person, the average person, they don't want to see a list of facts and figures. They want to see a real flesh and blood person that has gone through this, that can tell us about it and tell us about their experience. And that's what people do. So I think first and foremost, just these kind of events. And and you can go ahead now, Leah, but I just wanted to point that out. Like things like this are very helpful. We hear it a lot from the community.
No, yeah, totally agree. One of the, I was on a vaccine town hall rather, and one of our physicians, Dr. Monica Peak, who is a Black woman, talked about how having those personal conversations with her patients who were hesitant about the vaccine, who saw someone that looked like them saying, yes, this is something you can trust and this is something that's safe, just goes a long way. Having those interpersonal connections, like Gina said, it's not all about just facts and figures. That doesn't necessarily move the needle. So making it personal. And this is something I wanted to share. This is from a physician who is a Black woman, and she is Dr. Lauren Nephew, and she's at the University of Indiana. And she wrote a really compelling article about her own experience with, systemic racism, and how she had to, even as a physician, who knows, that the vaccine is safe, but she had to do her own dive into the data and make sure that there were enough people that looked like her that were represented in the COVID vaccine trials. And, that there is some mistrust that as a Black woman, she did have to overcome. And I like this quote here. It says, if you cannot comprehend how my experience of structural racism can overpower a decade of medical education, then you will have a hard time understanding vaccine hesitancy in communities of color. So I think for physicians and people who are trying to, make this push for COVID-19 vaccinations, it's just understanding that perspective of why there is mistrust in the medical community, and why some people would be hesitant to take it, and having these conversations. Go ahead, Gina.
And I was just going to say, Leah, I love that you found that quote, because it's such a powerful quote. It's very hard to unlearn things. If Big Mama said it, and her mama said it, and her mama said, talked about, this history of medical experimentation on African Americans or whoever, it's very hard to unlearn. So here's a medical doctor that said that it's very hard even for her, but she's done, she had to dive into the facts and figures. So just think of the average person who doesn't have a decade of medical education. If it's hard for her, it's hard for, it could be hard for anyone. So I love this quote, and it just really goes into the point. But it's up to us to change that narrative, to share our stories, to show people like, Ms. Singh and Mr. Foster and Mr. Kenneth, that these are people who want to be part of the solution. I love that Kenneth said that he wanted to be part of the solution. Mr. Foster and Ms. Singh, like, this saved my life. I've tried other things. It didn't work. It kept growing back. So to hear these kind of things, this is what's going to push this whole narrative of health equity along.
Absolutely. Do we have any, we're running a little late. Do we have any other questions before, Gina, can you see in the chat, do we have any other questions before we get to our?
Miss Renee is raising her hand. Did you want to say something? That's Mr. Foster's wife.
I do want to say something. I applaud you all for what you do, and even those that have been survivors of cancer and various illnesses. I want to also say this, that in talking to people through the years, while Billy has had cancer and I've gone through my various illnesses, I realized that often people do not have someone to speak up for them. They, as individuals, a lot of times, if they're sick, they can't really function enough to comprehend the things that are being told to them. So it's often at times good to have someone, a friend, or if you have a relative or somebody that can be an advocate for you. And at times I find that if the clinical trial or the doctor's department, or if you have some kind of agency within the hospital, that then they can refer the patient to who needs some kind of therapy, because they're being traumatized, or if they have a weakness in the areas of comprehension, then they can have somebody to teach them what it is and how best to get the help that's required in order for them to have the quality of life that they need to have. So far often we find that it's overwhelming. And you have some people who just have a fear of needles, let alone a doctor, let alone having some kind of surgery, or being, if you're in a clinical trial, just like in Billy's instance, he wasn't saying that. At one point he had a medicine that caused his lungs to bleed. So they started bleeding profusely. And he's saying to me that he didn't need to go to the hospital. So I'm fighting with him to say, you need to understand that I am not a doctor. I need to take you where you can get some help so that then they can better help save you if that's the case. So you have to at times have a better understanding of what the situation is. And when it comes to life and death, when it comes to death, you're not coming back. So you have to, get an advocate or get somebody that's going to support you.
That is such a good point. And, just having that advocate, like you said, I mean, I've had even physicians and medical doctors like diagnosed with breast cancer. And they said, when they gave me my diagnosis, I literally could not comprehend what they were saying. And I'm an educated woman, and they said, but when they gave me that diagnosis, I needed somebody there with me. I needed somebody to help navigate because I had to pull it all in. So those are all great questions. And just like you said, just to, make sure that we're not overlooking symptoms or, no, we're going to go, like you said, no, we're going to go. You're bleeding from your lungs. We're going to go to the doctor. And if they can help, then that's fine. So very, very good points. Thanks so much for chiming in. It was great to see you again.
Thank you. Thank you too.
Gina, do we have any other questions in the chat box that we need? Because we're over time now. So
yeah, we're over time. We apologize. Thank you so much for hanging out with us. I don't see anything. Is there any other questions? Ms. Singh, you wanted to say something?
Oh, no, I'm good. Thank you.
Okay.
So I'm going to move on to our announcements. But before we do that, again, just a huge thank you to our panelists. We're asking them to share real personal stuff with a group of strangers essentially, but your experiences are so important and your wisdom is so needed about this whole thing it's so important that you share your experiences, and we are really grateful to you all for taking your time out of your day to day to talk with us and share your stories. So thank you again to our panelists who could not have done this without you. We really appreciate it. We did want to, I just want to mention this suggested reading, and I'm going to send all these slides to everyone who's on this. But if you are interested in learning more about, we touched on some of the medical mistrust issues that exist within clinical research. And if you are interested in learning more about that, these are 3 great books. We've talked about The Immortal Life of Henrietta Lacks on these webinars before, Bad Blood, which goes into the Tuskegee syphilis experiment, and Medical Apartheid, which has, talks about a range of medical experimentation within the African American community and just medical mistrust. These are great books to learn more about that topic.